Monthly hospital performance figures for England have been released by the NHS, revealing a slight increase of people on waiting lists, whilst the number of patients facing the longest waits has fallen. So let's take a look at some of the data. The waiting list for routine hospital treatments in England has increased by 9,000 to around 7.37 million at the end of June. 2.4 million people visited A&E in England in July. That's the second highest month total on record. 76.4% of those people were treated within 4 hours. And 11,071 more appointments and procedures went ahead during the resident doctors' strike last month, compared to the 5-day walkout before last year's general election. Well, our health correspondent Ashish Joshi explains the figures.
That headline figure, it's one that the government will not want to see. 7.37 million people still waiting for treatment on that NHS waiting list. And that figure has gone up. So that tells us, one, that there is great demand for NHS services going into summer. Traditionally, it's been the winter periods which have been the busiest, but now we know that all year round there remains this demand on the NHS for patients seeking treatment. Whereas in previous months, that figure has gone down slightly. There has been an increase for June. To give you some context in all of this, there are health think tanks like the Nuffield Trust who have been looking at these figures and saying there isn't really enough transparency in what the government has done. It's taken patients off this waiting list because they might no longer need treatment. They don't live in the trust's catchment area. They've gone private. They might even have passed away. They've asked trusts to really look at their waiting list forensically. In some cases, we know that these trusts are employing outside consultancies. So this figure has gone down over successive months by about the 15%. The government says these people don't need to be on this register anymore, and therefore it needs to have a more accurate figure. But what these health think tanks are saying is that the government needs to be more transparent with the number of people who are on this waiting list and why it's actually taken people off who haven't received their treatment. So that's a context to this headline figure. But essentially, it shows that the government is still under a lot of pressure. We don't have the strike data for July. We have some of it, but it's not conclusive. It can't really be analysed, although the NHS England says that it did manage to see more patients during July's strike action by resident doctors than it did during strike action previously, so over the last 2 years. So that's what NHS England says, but we don't have the full data set to really examine what has happened and the impact it's had on this waiting list. But certainly it's made some gains with those 18-week waiting lists, but that headline figure remains stubbornly high, and that will give Wes Streeting some cause for concern because he and his government and Department of Health have made this their #1 priority, but it shows there is still a long way to go and it remains a challenge for the government.